This video is the fourth in a series about preparing for Medicare. Original Medicare is comprised of Part A and Part B and offers many benefits, but it has some gaps. The most important gap is there is no limit on out-of-pocket expenses, which encompass deductibles, copayments, and coinsurance. One way to fill many of these gaps is through a Medicare Supplement Insurance policy, also known as Medigap, that is sold by private insurers. Medigap policies come in several different versions, but must adhere to strict government standards. These standards allow easier comparison between policies and protect consumers from unscrupulous insurers. So what can Medigap cover? The main benefit of Medigap policies is capping out-of-pocket expenses for approved Medicare services. However, there are several other benefits that a Medigap policy may pay for, all or part. Examples are Medicare Part A coinsurance or copayments, Medicare Part B coinsurance and copayments, Part A hospice care coinsurance and copayments, skilled nursing facility care coinsurance for limited stay but not long-term care, Part A or Part B deductible, and foreign travel emergency care. As for things not covered, Medigap plans usually don't cover things like vision or dental services or hearing aids. Even though Medigap policies are standardized, there are price differences between plan types and companies offering the policies. Also, the states of Massachusetts, Minnesota, and Wisconsin classify Medigap policies differently. More complete descriptions and comparisons of plan types can be found by Googling the Medicare publication, Choosing a Medigap Policy, a Guide to Health Insurance for People with Medicare. So how does Medigap work? With original Medicare and a supplemental Medigap policy, Medicare will first pay its share of covered costs. Then the Medigap policy pays all or part of the remaining cost. The percent of the remaining cost paid depends on the type of policy purchased. Medigap can only be purchased to supplement original Medicare. Medicare enrollees who have coverage through Medicare Advantage or Medicaid cannot also have Medigap coverage. How do you go about getting a Medigap policy? First of all, the purchase must occur during the Medigap open enrollment period, which covers the 6 months beginning when a person turns 65 and is enrolled in Part B. Medigap coverage may not be available for purchase outside this period. Still, if it is, it may cost more. Some people don't sign up for Part B at age 65 because they are still covered by company or union healthcare insurance. In this case, the 6-month Medigap open enrollment period begins when they eventually enroll in Part B. The process for buying Medigap coverage is greatly simplified by using the online Find a Care Plan tool by going to www.medicare.gov/plan-compare. Go to the page and find New to Medicare heading, and under that heading, click the icon Learn More About Options. You'll be prompted to enter your zip code, and then the screen will appear with one side devoted to Original Medicare and the other side to Medicare Advantage. Click Original Medicare. Then a screen will appear with the heading Your Medicare Coverage Options. Under the heading Add Extra Coverage, click the box for Medicare Supplemental Insurance Medigap. The screen will then update with the price range for Medigap policies. When you're ready to look at specific plan types, click at Look at Plans at the bottom of the page. On the subsequent page, click Medigap Policy Only and follow the prompts to find plan types and companies that offer plans. As a final note, here are some things to keep in mind about Medigap coverage. Medigap policies have a premium cost in addition to Medicare Part B or Part D premiums. A Medigap policy covers one person. Couples must obtain separate policies. And if you have Medicare Advantage plan, you cannot buy Medigap coverage.